Welcome everybody to our Grief Matters series on pregnancy and infant loss. Our first talk of the series is body talk, talking about physical changes that your body may go through at various stages of pregnancy loss. So my name is Emma Needleman. I'm an international board certified lactation consultant and former midwife. I'm also a mother of 2 boys, and I've had 3 pregnancy losses myself. I've had an early miscarriage, ectopic pregnancy, as well as my son who was stillborn in 2017. I'm coming at this information from a professional background, but also from a very personal experience background. So hopefully this is informative for all of you. And I just like this little quote here: sometimes the smallest things take up the most room in your heart. So we'll talk about losses at various stages of pregnancy. The first trimester is that time from conception to 12 weeks gestation. A loss at this time can be quite isolating if you haven't announced your pregnancy yet. So some people choose to wait until after the first trimester to, for a variety of reasons. And so if you haven't shared that news with anybody, sometimes it can be sort of extra lonely and a sadness that you kind of carry yourself. And all losses are isolating, but this one sometimes can have just that extra piece to it where you may not have shared with your family and friends. So the different types of losses we see in the first trimester include a miscarriage, missed miscarriage, ectopic pregnancy, and a molar pregnancy. And we'll go through what each of those is. So a miscarriage is when the pregnancy is no longer and you start to bleed. So this can happen at any time from conception to 12 weeks. And most of the time, we never really know the reason why. Sometimes there are sort of medical issues that can lead to repeated miscarriage, but sometimes, in fact, the majority of the time, we don't really know the reason why it happens. So this is when the body sort of releases the embryo or fetus, depending on the stage of pregnancy, as well as the uterine lining and the placenta. So this is, it looks like bleeding. So if it's early, sort of 8 weeks and under, it may look like a very heavy period, okay? There may be some smaller clots. It may last a bit longer than your typical period would, and may come with some more cramping, that sort of thing. If you're sort of 10 weeks and more, this type of miscarriage may be a lot more painful. So at that point, you may have more contractions of the uterus rather than just cramping, and you may see more, there might be heavier bleeding, and you might see some more tissue. So that's definitely something that people are concerned about. And so there is a fair amount of bleeding in that sort of 10 to 12 weeks if you have a miscarriage at that point. A missed miscarriage, this is when the baby stops growing at some point, but the body doesn't release it. So you never have that bleeding and letting the pregnancy go. Usually this is found on an ultrasound. So this would be, you would be going for a dating ultrasound or a first trimester ultrasound if you were doing screening or anything like that, or if you've had a history of miscarriages or ectopic pregnancy. And so it would be seen on the ultrasound that the baby had stopped growing and there was no heartbeat. And that's often, we don't find it out kind of before that because your body's not bleeding. So there's sort of 2 ways of dealing with this type of miscarriage or missed miscarriage. There's a more conservative approach, which we wait and see what happens. So you would let your care provider know, and you and your care provider would sort of decide what the best option would be. And much of the time we'll sort of wait and give your body some time to release the pregnancy on its own. Typically, we wouldn't want to wait too long after finding out, but it might be a week or so. So just sort of watchful waiting. The other is a more active approach. This is where your care provider might prescribe you a medication to help your body to release the pregnancy, or something called a DNC, which is done, it is a surgical procedure done at a hospital. I think I talk about it more in a little bit, so we will get to that point. The other type of pregnancy loss in the first trimester is something called an ectopic pregnancy. So an ectopic pregnancy is when the egg, so an egg is typically released out of the uterus, and then the fallopian tube kind of sweeps it in where it is fertilized, and then the egg travels to the uterus. For some reason, again, we don't always know why, that fertilized egg will then embed in the fallopian tube rather than traveling to the uterus. And then it starts to grow there. This is very dangerous because if your fallopian tube ruptures, you will have internal bleeding, right? It's very, very painful. And if it ruptures, you need to have surgery to stop the internal bleeding, essentially. If it's caught prior to rupture, then there is a medication that your care provider will prescribe you to help dissolve that fertilized egg so that it doesn't continue to grow and rupture. So this is one that if you've had a history of ectopic pregnancies, you may be more likely to have another one, not necessarily, but typically you would go for early ultrasounds following having had an ectopic pregnancy. And it's one that it's very, very rare, but it can happen. Well, the other one I didn't make a slide about, I just realized, is the molar pregnancy. A molar pregnancy is when it's not actually a viable pregnancy, like there's no embryo that begins to develop. It's sort of in lack of a better word, an empty egg or sperm. So an egg or a sperm that doesn't actually have genetic material in it. And so when they combine, they make it grows and it makes tissue, but it's not an actual viable fetus. Okay, so it's more just sort of a collection of cells, if that makes any sense. And a molar pregnancy typically needs to be removed via surgery as well. And when we talk about these DNC or an ectopic surgery or a molar pregnancy surgery, they're very, very quick surgeries. So it would be one that you would go into the OR, be given an anesthetic, so you would be asleep for it. But typically the procedures last anywhere from sort of 15 to 30 minutes max, typically. So it's a very quick procedure where the lining of the uterus is cleared out in a DNC or with a molar pregnancy, or in the case of a ruptured ectopic pregnancy, the fertilized egg and the fallopian tube is removed. So that fallopian tube comes out because it's been ruptured and it can't really be fixed, and then sort of cauterized so that you're no longer bleeding. So the ectopic pregnancy surgery, a ruptured ectopic, tends to be a little bit more invasive because it is abdominal surgery. You have to kind of go in from the abdomen, usually done laparoscopically, but a DNC in a molar pregnancy is done through the vagina into the uterus, and it's not as much healing time because it's not an actual, there's not any incisions being made in the body. So how to care for yourself afterwards. When we're thinking about having had a loss, again, we will likely be having a fair amount of bleeding. So it could be like a regular period lasting for a few days, depending on how far along you are, or it could be much heavier and lasting for a couple of weeks, depending on your gestation. You're going to want to use pads or liners for the bleeding. So no tampons, no menstrual cups, so nothing in the vagina, especially following an ectopic surgery. Now, you may not have bleeding after an ectopic surgery because there wasn't anything in the uterus to grow. The bleeding was sort of internal from the fallopian tube, so it's less likely that you'll have bleeding after that, but making sure that nothing is going in the vagina. You may have some breast or chest changes as well, again, depending on how far along you were in your pregnancy, what number of pregnancy this was, if you'd had a baby in the last year or so. So you may have some tissue growth, breast tissue growth potentially, you might not. If you have never nursed a baby before, you may not have those breast changes as noticeable, simply because that tissue isn't there yet. If you're having discomfort or anything, applying cool compresses and extra supportive bras or bindings around the chest if you're feeling just sort of achy, which can sometimes happen. And then one of the questions, of course, that everybody asks, I certainly did myself, is wanting to know when your fertility returns after a loss. So it depends, but typically for those people who menstruate regularly, so not everybody does menstruate regularly, but for those who do, you will likely have a return to fertility within sort of 1 to 3 months. We are going to talk a little bit later in the presentation about why the recommendations for waiting a few cycles, why that is, so we'll get to that. But typically you'll see if you have menstruated regularly, you've had a regular ovulation cycle, you should see a return to fertility fairly quickly after an early loss. Then we have the second and third trimesters. So if you have a loss prior to 20 weeks, it's still called, in the medical terms, it's still called a miscarriage. So I just want anybody who has experienced this or who may experience it to not be sort of put off by that language, that if you have a baby, you deliver a baby in labor, you hold your baby, it's still a pregnancy loss, like it's still, you've still labored, it's still a birth. It's just in medical terminology, it's called a miscarriage rather than a preterm birth, which we'll talk about in a second. And that's simply because they've just need to have a cutoff point. And so it's more just for medical care providers being able to describe it, okay? And if it's prior to 20 weeks, so if it's that second trimester before 20 weeks, again, there's going to be sort of more of a labor-like pattern, probably some more cramping and pain and bleeding than you would maybe see at 8 weeks or less. After 20 weeks, if you go into labor or are induced for any reason, it's called preterm labor or stillbirth, depending on the outcome. So in that second trimester, if you go into labor at 24 weeks, it is called preterm labor. And then we call it stillbirth if your baby is born not alive. So if the baby passes before birth, then it's called a stillbirth. If your baby is born alive but passes shortly after, it's a live birth. But it's called preterm labor from 20 weeks until 37 weeks. And then at 37 weeks to 42 weeks, you're considered full term. So that would be a term labor. And again, we don't always know the cause. We may find out the cause afterwards. We may never find out the cause. And so it could be various things, like the baby could have passed inside already, rather than during labor or after birth. That could be due to sort of placental problems. So we sometimes hear of something called placental insufficiency, where the placenta just for some reason isn't getting enough nutrient or oxygen across the blood barrier, essentially, to the baby. It could be other placental problems, can be a placental abruption. So that's when the placenta comes away from the wall of the uterus, and then the bleeding is going in between the placenta and the uterus, rather than blood getting to the baby. So PPROM, this is called preterm pre-labor rupture of membranes is PPROM. Then there's just PROM, which is pre-labor rupture of membranes. So preterm, this is when your waters break before 37 weeks and before any labor has started. So in my personal experience, I had a pregnancy with continued placental abruptions. I had bleeding throughout. The placenta kept coming away from the uterus and back on and away and back on, and had bleeding. And then actually experienced PPROM, where my waters broke at 21 weeks gestation. And then I had a number of problems after that. But so PPROM, if the waters break, often you will go into labor on your own within sort of, whether it could be within 24 hours or it could be a number of weeks later. Sometimes we also will see cervical issues. So there is a term, a terrible term called incompetent cervix, which I just think is a terrible name. But it's when the cervix, for whatever reason, we don't always know, it doesn't stay closed. So normally the cervix is a long, firm, closed piece of muscle. It's actually the bottom of the uterus. It's also the neck of the uterus. And it typically points back towards the tailbone. It kind of tucks in everything. And then when you start to go into labor or towards the end of your pregnancy, the cervix starts to thin out. It's called effacement. So it's really thick and it thins out. And then it also opens up. So that's the dilation. Most people know about the dilation. The cervix has to open, but it also has to thin. And sometimes when we see preterm labor, is that the cervix is already starting to thin out and or starting to dilate without any labor signs. And what can happen when that happens in the second or early third trimester is that the baby can actually come through the opening of the cervix, or the membranes, the bag of waters can come through, and then there's pressure and then they break. So sometimes that is an issue. Congenital issues, so different sort of problems with the baby that may lead to not being able to live outside of the womb, or trauma or an accident. So having been in a car accident, falling from a great height, something like that, that can impact the uterus. And then again, usually that will cause problems with the placenta, either coming away from the wall of the uterus. So these are some possible causes of having a loss in the second or third trimester. But again, we don't always know why these things are happening. And sometimes it also just happens. And this is the really horrible, scary part, is that we don't know or have control over it all the time. So if any of these things happen to you, you have bleeding in your pregnancy that is more than some light spotting. If your membranes rupture, if you're feeling something heavy pressure in the vagina, or you're feeling something in the vagina, or it feels really heavy, or if you've been in a car accident, even a minor accident, any of these sorts of issues, you need to contact your care provider or go to the hospital right away to be assessed, okay? So things that happen, what might happen, sort of the physical changes after having a second or third trimester loss. So again, we're going to see bleeding, right? So why we have bleeding after a birth, a loss, but also just from birth in general, is that the placenta is the organ, the baby's organ, it really is a baby's organ, not yours, is the organ that's responsible for the blood, and it's called gas exchange, so nutrients and oxygen and carbon dioxide being passed back and forth so that the pregnant parent can breathe off their carbon dioxide. But the placenta grows and grows and grows and grows along with the baby. And then, typically, depending on how your gestation, but like the placenta can be, a fair size depending on how big your baby is. But that placenta comes off, right? We deliver the placenta, and then you have a wound, essentially, of the size of the placenta on the inside of your uterus. And that's what is bleeding most of the time. And that's what we see happening in the postpartum, in the second and third trimester losses, is that bleeding is actually from the placental site. So you may have bleeding that's heavier than a normal period. It typically will last sort of 2 to 4 weeks, depending. If it lasts for longer than that, you need to contact your care provider because there could be something happening, that there could still be a bit of placenta inside or something like that. You also may notice that your perineum, so that is the skin of the vulva outside of the body, and also potentially on the inside of the vagina, could be quite sore. Again, depending on how far along you are, but it can be, having had birth can be quite sore. You may have some lacerations and might need some stitches, those sorts of things. So to care for your perineum afterwards, things like ice packs. So sometimes people will put, with a menstrual pad, put some water or witch hazel on it and put them in the freezer, and then use those to help reduce any swelling. Epsom salt baths or sitz baths. So a sitz bath is just a contraption essentially that sits over top of your toilet, so you can sit in it and have your perineum kind of soak in the water, but you can also just go in a regular bath, and putting Epsom salts in that to help really kind of clear it out, clean it out. And then this might sound strange to some people, but using a hair dryer on the perineum. So you're going to use it on the cool setting, not the hot setting, after you've had an Epsom salt bath, especially if you've had any stitches. And really dry the area out really, really well in between soaking it to get it, to clean it out, and then hair dryer to get air at it to really help to speed up healing and help with recovery. So we also have, so I have NSAIDs down there. That just means non-steroidal anti-inflammatories. So that would be like ibuprofen or naproxen you can take afterwards. You can't take those two together. You can't take two different NSAIDs together, but you could take ibuprofen and acetaminophen, or naproxen and acetaminophen. So another name for Tylenol, acetaminophen. You may also have just in general body aches. So especially if you've gone, if it's the second, third trimester, if it's sort of further along and having had, you may have had a long labor. If your baby had passed prior to being in labor and you're being induced, for example, sometimes inductions, especially an induction before your term, can take a really long time. So you may have been laboring for a number of days and just really achy and sore. After having a baby is a lot of work. And after being in labor, you may just be having like neck and shoulders are sore from kind of gripping things and pushing. Legs can be sore from pushing. Your pelvic floor, so again, the perineum can be quite tender, and again with the possible lacerations, and then the core as well. So having pelvic floor physiotherapy after, which I think I touch on in a few minutes, can be really, really helpful as well. And then one of the other things that happens after having a baby in the second or third trimester that is no longer with you is that your breasts or your chest will start to produce milk. And this is a hormonal response. So again, why might this happen? So you may, again, depending on how far along you are, but if it's after sort of that 20-week mark, your breast may, or your chest tissue may develop more. They may grow in size, and your body starts to produce something called colostrum right around 20 weeks gestation. So colostrum is that the first milk that the body makes for your baby before your mature milk starts to come in, and it's ready kind of around 20 weeks. But what happens is when the placenta leaves the body, so that's what triggers the brain to start to produce prolactin, which is the hormone to make milk. So sometimes people will think that you have to be in labor to make milk, which is why sometimes when people have planned C-sections, they worry about that, but that's not true. It's actually the hormonal shift from the placenta leaving the body. So the placenta a lot of jobs, but one of its job is to produce a hormone called progesterone. So progestation, it's really to maintain the pregnancy is its main job, and it makes a lot of progesterone. And when that progesterone is suddenly out of your bloodstream with the delivery of the placenta, that drop in progesterone triggers your brain to release prolactin, which makes milk. And so typically we'll see that sort of mature milk come in around day 3 to day 5 postpartum. So whether you are pumping or not, or nursing or not, typically the milk will sort of at least come in somewhat because it's a hormonal response. And when your baby doesn't go home with you, this is one of, in my experience and in experience talking to many, many parents over the number of years, 15 plus years, that is one of the most painful, is that you've delivered your baby, you don't have your baby with you, you have to go home without your baby, and then a few days later, your body starts to make milk. And it can just be sort of another sucker punch, really. And so there's a couple of ways of dealing with your milk coming in, and there's no right or wrong way to do it. For some people, they actually choose to pump their milk and donate it. And often what I've heard for this reason is it makes them feel like their baby is still here, and that their baby's life mattered, which all babies' lives matter. In losses, they all are important. So whether you choose to suppress your milk or you choose to donate is not a judgment call at all, is what I'm saying. But some people having that ability to pump and donate their milk to a milk bank or to Human Milk for Human Babies, which is a milk sharing program, it makes them feel like their baby's life is helping other babies. And so that's one way that they are able to feel some sense of relief in it. Others may want to suppress their milk coming in, that they do not want the reminder that they don't have a baby to nurse, and they want the milk to be gone as soon as possible. And so some ways to suppress your milk, again, those cold compresses, so ice packs, because when your milk comes in, it's also an inflammatory response. So there's a lot of lymph fluid and blood flow and a bunch of just inflammation. So ice packs, cold packs, frozen vegetables on your breast or chest will really help with the discomfort. We also see more restrictive bras or binding to be helpful too, just kind of holding everything in. And that will also help with the discomfort. Sage, the herb sage, is also a well-known herb for suppressing milk. So you can get it in tea format. I have tincture on here simply because the tea is great, but you have to drink a lot of it, sort of like 4 or 5 cups a day, and not everybody is able to drink that much. So you can get it in tincture form, which just means it's a lot more concentrated. And you'll take that a number of times a day in some water. There are also some over-the-counter medications that their sort of off-label use is for suppressing milk production, which I won't go into here, but there are some other options. And then again, with your Tylenol and Advil can be really helpful with that discomfort. And so we're talking about these body changes. So understanding that you have gone through a pregnancy and a birth after the 2nd and 3rd trimester, and that no matter when your loss was, so there was a birth at that point, but prior to 20 weeks, you may have had a birth too, depending on when your loss was, but that no matter what, you've gone through a traumatic event, physically traumatic as well as emotionally traumatic, and that rest is important. One of the things that can be really difficult, and another sort of body and mind change after a loss, is insomnia. Insomnia is very, very common after a loss. So just having sleeping difficulties. It can be really, it can be During the day, if you're around people, you have a good support system, you kind of keep yourself busy. If you have older children, you may be busy, or you've gone back to work. For many, some people need to do that after they've had a loss, want to go back sooner. And some people don't. Again, there's no right or wrong way to do it. But that sort of that daytime busyness can keep us going. And then nighttime hits and it's dark and it's quiet and there's no one around or they're sleeping. And that's when thoughts can come that are not conducive for sleep. So sleep can be really difficult in the early days and weeks of pregnancy loss. And so important to talk with your care provider, of course. Always keep in touch with your care provider, and really trying to focus on getting that sleep in order, because when we're tired, we can't handle things as well, right? So it becomes this sort of vicious circle. We also really want to think about our nutrition, nourishing ourselves. Again, with loss and with grief in general, appetite is one of those things that is often affected. So sleep is affected, appetite is affected, whether that is overeating or not eating enough. It often has effects on our appetite. And so we want to make sure that if we're not eating, to eat. It can be hard. We often don't feel like it, but understanding that, again, no matter when your pregnancy loss occurred, you are recovering from pregnancy, no matter the stage, and that we will recover physically from anything physical with adequate food and nutrition. We'll recover a little bit more quickly or more fully. So we want to think about foods, high protein, high iron, and then getting lots of vitamin C. And so we want high iron foods. We want to make sure we're getting enough iron to replenish our iron stores, because pregnancy diminishes our iron stores. It's supposed to, that's okay. But then the blood loss as well. So making sure we're getting enough iron in. Protein, I put in there, especially glycine. Glycine is one of those amino acids that helps with tissue formation. So helping to rebuild your tissue. And vitamin C is also one of those. So vitamin C works kind of with glycine to help repair tissue damage. So helping if you've had any lacerations, or just helping everything kind of form a little bit more quickly. We also want to think about hydrating ourselves. After a loss, there's a lot of fluids coming out of our bodies at various stages. You've got blood coming out. You may have milk being produced as well. But another thing that often happens in the postpartum, again, regardless of the stage that you've lost your baby, is sweating. So the hormonal shift from being pregnant to not being pregnant causes a lot of just sort of, you might hear of it in menopause, for example, hot flashes. So it's very similar, having these hot flashes and sweating. People will often wake up in the night sort of soaking wet with their bed wet and their pajamas wet. So you're sweating a lot more in the postpartum just due to hormonal changes. So making sure you're staying really well hydrated will also help you recover more quickly. Pelvic floor physio, so physiotherapy for the pelvic floor is something that I think is important for all pregnant people and postpartum people to do. Again, depending on your type of loss and when you had it, you may not be ready for connecting with your pelvic floor for any time soon, and that's okay. But thinking about it in the back of your mind as something that might be helpful to look into at some point before trying again for another baby potentially. Massage, we know that massage helps with our aching muscles. It helps us to relax. It's another form of kind of taking care of ourselves. Acupuncture, I'm a super big fan of acupuncture. And acupuncture has so many benefits, physical and emotional. It's going to help to regulate that nervous system. So it can be a really big piece in the sleep department. So if you're having trouble sleeping, acupuncture can be really helpful in just bringing that nervous system back down so that you're able to sleep, but also will help with different things like getting your cycles regular again. It has a multitude of benefits. And of course, counseling. So the body and mind cannot be separated, right? We are having this human experience, our bodies, what is happening to our bodies affects our minds, what's happening in our minds is affecting the body. And that it's really, really important to seek some sort of therapy or counseling following a loss, whether that is, you know, a one-time session and you talk to somebody and you feel things are resolved, that's cool. Whether it's an ongoing support, regardless, I think it's important for every parent that has had a loss to engage in some sort of counseling or therapy. As well as, I would put with that, there are also so many incredible support groups outside of a more traditional therapist or counselor. Ended Beginnings with Hospice Simcoe, of course. The peer support in that is just priceless. There are different types of groups around to find that support so that you are talking with other people who have been through what you've been through and who understand, and who can help you navigate potentially your grief or your experience or anything to do with celebrating your baby. Really important to reach out and not kind of further isolate yourself, because it's not going to serve you. And the other thing is time and space. So giving yourself time off work if you can, time off from trying to conceive, space from people who are either not supportive or who don't understand. Sometimes I remember for myself being just entirely full of rage of talking with anybody who didn't have a loss, who just couldn't comprehend what I had been through. And I found it very, like I can't describe it any other way than just full of rage. I was just mad that I didn't have my baby. I was mad about everything. And I only wanted to be around people in those early stages who had also had a loss and who understood. So understanding that that's a normal thing to want and to seek out as well. Sometimes for some people, going back to work early might be a good thing, that they want to do that that's a helpful in their self-care. That is self-care for them. So do what feels right to you, but making sure that no matter what it is that you need, it's okay to need what you need. The other piece that I wanted to touch on that I meant to mention earlier, and then maybe I said I would come back to it and I don't think I did, was the idea of return to fertility and the recommendation of waiting a few cycles before trying for another baby. So after you've had a loss, again, no matter what type of loss it is or when it occurs, there's always that question of trying again. For some people, they don't want to think about it. They need a lot of time. They are not thinking about when they want to try again, and that's just not where they're at. Other people want to try again as soon as possible. And again, there's no right or wrong way. It's just everybody's experience is different. And you'll often hear sort of care providers suggesting waiting around 3 months or 3 cycles before trying again. And sometimes we don't always understand why that is. And if we can understand why that is, then we may be able to make better decisions for ourselves. So it's not just an arbitrary wait a couple of cycles because you're grieving and you need time. Like, yes, that's true. But again, for some people, trying again is part of their grieving process and helping to move through their feelings. The reason is that, and for anybody who's undergone infertility treatments, you'll know what I'm talking about, but the lining of the uterus needs to be a certain thickness in order to be hospitable or like a good place for a fertilized egg to implant in. And after we've had a loss, that lining has been expelled, which happens every time you menstruate. That's what that is. The lining builds throughout a cycle. And then if there isn't a pregnancy, then that's what your bleeding is the lining of the uterus. But we need that to rebuild. And we also want to see some regularity in your cycle. So we want your body to have time to rebuild, recover from a pregnancy, and then allow it some time to sort of build up that uterine lining, so that when and if you do choose to try again, you have sort of better odds, essentially. So it can be a hard topic of that, and this isn't our topic that we're talking about today of when to try again, but I think that that's an important piece to put in when we're talking about physical changes, because it's often a question that people have, and it is a physical reason why. Yes, there are all of the emotional reasons of why you may or may not choose to try again at a certain time, but the physical side of it is that your body needs time to recover, and it needs time to get back to a regular cycle of ovulating and menstruating, so that we just want to have a more balanced, healthy environment in your body as possible. So that is the end of this presentation. If you have any questions, we're going to be answering them. But if you have further questions beyond this, contact me for any reason. This is my information, my website, and my email. Please feel free to reach out with any questions, share your stories, anything at all. I love working with Hospice Simcoe. They do amazing work. The Ended Beginnings program is just an incredible program. I'm also on the board of directors for Bridget's Bunnies, which is another charity in town for pregnancy and infant loss awareness. So you can also reach out to me through them. There's many different ways to find me if you have any other questions or comments or want to share anything at all. So thank you so much, and we'll see you in the next workshop.